बिस्मिल्लाहिर्रहमानिर्रहीम। बिस्मिल्लाहिल्लज़ी ला यदुर्रु म'a इस्मिही शैउन फिल अर्दि वला फिस समा व हुवस समीउल अलीम। शुरू उस बाबरकत ज़ात के नाम से जिसकी मौजूदगी में ज़मीन व आसमान की कोई चीज़ इंसान को नुकसान नहीं पहुँचा सकती। खालिक कायनात मालिक कायनात की मर्ज़ी के बगैर एक पत्ता भी नहीं हिलता। ये हमारा ईमान है और ये हमारा ईमान होना चाहिए और पुख्ता होना चाहिए। आज का टॉपिक एक्यूट सपोरेटिव ओटाइटिस मीडिया, which is, as the name indicates, it's the inflammation of lining of middle ear cleft, that is middle ear, eustachian tube and mastoid intermediate cell by pus forming organisms. That is why the name is suppurative otitis media. Pus forming organisms responsible for infection in this area of middle ear, also involving the eustachian tube and mastoid intermediate cells. The eustachian tube, from your knowledge of anatomy, you know we have already discussed it in the subject of anatomy, that eustachian tube is the only connection of middle ear with the external environment. And this eustachian tube on one side opens in the anterior wall of middle ear and on the other side in the lateral wall of the nasopharynx. For normal functioning of middle ear, that is conduction of sound, we require equalization of air pressure between the atmosphere and middle ear cavity, which is otherwise a closed small cavity having only connection with the environment through the eustachian tube. This eustachian tube intermittently opens by the act of swallowing. Everybody of us, after a few minutes, swallows his or her saliva unknowingly. The saliva swallowing has got its own function, but apart from that, this swallowing act is also responsible for opening of pharyngeal end of eustachian tube, allowing the air entry to pass through the eustachian tube towards middle ear or otherwise, vice versa, so that the air pressure between the middle ear and atmosphere is equalized for normal functioning of middle ear. Now through this eustachian tube, the route of entry of infection occurs. Among the routes of entry of infection, on the top is eustachian tube. The patient gets upper airway infection, and that infection can travel via the eustachian tube towards middle ear cavity. This condition is common in children because of following reasons. Number one, the children has got resistance in general less than adults. Number two, the eustachian tube of children is relatively shorter and wider than adults, relatively. And thirdly, the eustachian tube in child is more horizontally placed as compared to an adult person. Because of these three factors, the infection from the upper airway via the eustachian tube can spread towards the middle ear relatively more easily in children as compared to adults. Certain studies have been made about the incidence of acute suppurative otitis media, which show that up to the age of 4 to 5 years, most of the children, a vast majority of children, gets an attack of acute suppurative otitis media. The second route of spread of infection is via an open perforation in the tympanic membrane. This perforation may be because of previous attack of acute suppurative otitis media, or because of trauma, or because of any other reason. The infection from the external ear can very easily travel through this perforation, entering the middle ear cavity. And the third route of spread of infection is via blood-borne. The blood-borne infection, that is, the patient having bacteremia, septicemia or pyemia, infection can settle in any organ of the body, and so is true for middle ear. No doubt this is a relatively less common route. More common in children as well as the people who are having low hygienic condition and living in overcrowding situations, or the people having malnutrition. They also have effect on the causation of this condition. Acute infection in the middle ear, they are also more common in winter season. As you all know, in winter season, upper airway infections are more common in extremes of weather. So, upper airway infection will be more commonly traveling towards middle ear in winter season. Apart from that, if there is a nasopharyngeal mass, a space occupying lesion in the nasopharynx, obviously this will also be responsible for infection in that area because of stasis of secretions, plus this space occupying lesion directly can affect the pharyngeal end of eustachian tube, causing its obstruction. Initially, of course, it will be partial obstruction, and later on it can be more and more complete or near complete obstruction. So nasopharyngeal mass is also responsible for malfunction of the eustachian tube and infection in the middle ear. The examples of these nasopharyngeal masses include adenoids, which is again a condition in children. An infection in the adenoids and excessive hypertrophy of the adenoids is responsible for malfunction of the eustachian tube, and it facilitates the traveling of infection from the nasopharynx towards middle ear cavity. The neoplasms like carcinomas or nasopharyngeal angiofibromas, they can also be responsible for the same effect. Then postnasal pack, which is sometimes needed in cases of severe epistaxis, that will also be acting as a space occupying lesion for the time being. Stasis of secretions, infection, and that infection can travel towards the middle ear cavity. Persistent respiratory diseases like rhinitis, sinusitis, and tonsillitis, being a persistent source of infection in the vicinity of eustachian tube, can also be responsible for traveling of infection towards middle ear cavity. Pre-existing middle ear field, that is secretory otitis media, which we have talked about in the previous lectures, can also be a predisposing condition for infection, suppurative infection, to start in the middle ear cavity. Then immune deficiency syndromes, relatively rare causes of infection in the middle ear, and cleft palate, another common congenital condition. The cleft palate will be responsible for dysphagia in children, and the food material, eatables as well as drinkable, they can easily flush towards the nasopharynx, causing infection in the nasopharynx and traveling that infection via the eustachian tube towards middle ear cavity. Microbiology, the organisms, as we have talked about, it is a suppurative infection. That is, pus forming organisms are responsible for this infection. They include H. influenzae, Streptococcal pneumoniae, Beta hemolyticus streptococcus, Staph aureus, M. catarrhalis, etc. These are the causative agents which are common in upper airway, and they are responsible for infection in the middle ear. So pathologically what happens when there is infection in the middle ear? First there is mucosal edema, then there is hyperplasia and hyperemia. Hyperemia with white cell infiltration and ultimately pus formation. The formation of the pus, how it occurs, you already know very well from your knowledge of pathology. And ultimately, when the pus is collected in the middle ear cavity, that ruptures the tympanic membrane and the pus evacuates out, and then the healing starts. We will just discuss the various clinical pictures in the process of this acute suppurative otitis media, that is the various stages. We'll just discuss it. Now this infection can also spread towards the surrounding areas, that is retrograde thrombophlebitis, bone necrosis. If there is some congenital dehiscence, this infection can travel towards the intracranial structures also. Or if there is previous fracture line, that can also be responsible for spread of infection to the surrounding areas. The complications which can be there, that are intracranial as well as extracranial. The intracranial complications include extradural abscess, subdural abscess, meningitis, brain abscess, lateral sinus thrombosis, and otitic hydrocephalus. These complications we will discuss in a little bit detail later on. Extracranial complications may include labyrinthitis, which may be suppurative labyrinthitis, then facial nerve canal opening causing facial nerve paralysis, first paresis and then paralysis, then various abscesses in the neck, that is Bisol's abscess, Cytales abscess, Gradenigo's syndrome, which include the facial pain and seventh nerve involvement along with suppurative otitis media. We will discuss these things a little bit later on in the next chapter. Now let's discuss the symptomatology. Otalgia is one of the symptoms of this condition, that is pain. Obviously, to start with, it is an inflammatory condition. There is swelling, and when the swelling goes on increasing in a small closed cavity, patient will start having pain, and this pain will go on increasing with the further proceeding stages of the condition. We will just discuss it. To start with, the pain is mild and it will go on increasing with the progress of disease. The second important thing is deafness. Initially, because of inflammation in the middle ear and swelling in the eustachian tube, patient will have mild conductive deafness, and that will go on increasing in severity. And this conductive deafness can be easily confirmed by a very simple test, that is tuning fork test. When we will perform a Rene's test in this patient, the Rene's will be negative, indicating conductive deafness. And if we perform Weber test, that will be lateralized towards the affected ear, confirming the presence of conductive deafness. Other tests can also be done, but these two simple tuning fork tests, they are sufficient for proof. They are sufficient proof for presence of conductive deafness in this case. And the third symptom is discharge, which is most of the time mucopurulent or purulent. Obviously, in early stages, there will be no discharge, but when there is perforation of the drum, then this discharge will come out. And when the discharge comes out, the pain also decreases. बस चल खत्म कर
कि अगला दिन है,
अगला लाया जाएगा
मैं स्टार्ट कर